Hello, I'm Essay, your AI essayist. Please note that all content, audio and video in this presentation are AI generated. As AI can sometimes produce inaccuracies, I encourage you to verify any factual information presented. With that in mind, let's begin.
The dawn of the 20th century was an age of immense scientific optimism, a period where the laboratory was transforming into a crucible of modern life. Within this milieu of feverish discovery, few diseases cast a shadow as long and menacing as syphilis. Known as the Great Pox, it was a biological spectre haunting every level of society, a malady treated with the brutal and often futile empiricism of mercury and iodides. The intellectual climate, however, was primed for a revolution. The monumental work of Louis Pasteur and Robert Koch had firmly established the germ theory of disease, providing a tangible enemy to conquer. The final prerequisite for a targeted assault on syphilis arrived in 1905, when Fritz Schordin and Erich Hoffmann at the Charité Hospital in Berlin identified its elusive causative agent, the pale, corkscrew-shaped bacterium Spirochaeta pallida. This discovery provided a specific target, the world awaited a specific weapon. The conceptual framework and the relentless will to forge such a weapon resided in the mind of one man, Paul Ehrlich. His 1909 paper, co-authored with his gifted Japanese colleague Sahachiro Hata, titled The Experimental Chemotherapy of Syphilis, was far more than the announcement of a new drug. It was the apotheosis of a systematic research philosophy, the definitive proof of a concept that would forever alter the course of medicine, the majuscule, or magic. Ehrlich's quest was a departure from the serendipity that had characterized much of pharmacological history. His intellectual journey began decades earlier, amidst the vibrant hues of aniline dyes in the histology laboratory. As a young researcher, he became captivated by the selective affinity of certain synthetic chemicals for specific cells and tissues. He observed how methylene blue-stained nerve cells, how other dyes targeted particular cellular granules. This phenomenon of specific binding was, for Ehrlich, a profound revelation. It suggested a fundamental principle of biological interaction based on precise chemical structures. From this foundation, he extrapolated his famous side chain theory, or Satan-Ketan theory. Initially conceived to explain immunology and the action of antitoxins, the theory posited that cells possess specific chemical receptors, or side chains, on their surfaces. These receptors could bind with lock and key precision to corresponding structures on toxins, nutrients, or, most importantly for his later work, therapeutic agents. A substance, he reasoned, could only act upon a cell if it was first fixed to it, a principle he summarized in the Latin dictum, corpora non agant nisi fixata. This theory provided the intellectual scaffolding for his entire chemotherapeutic program. He envisioned chemical agents designed to possess a high affinity, or parasitotropism, for the invading microbe, while exhibiting a low affinity, or organotropism, for the host's own tissues. The ideal agent would be a chemical missile that sought and destroyed the pathogen, leaving the host unharmed. This theoretical vision required a robust industrial and experimental engine to become reality. Ehrlich found this at the Georg Speyer Haus in Frankfurt, an institute founded with the express purpose of pursuing chemotherapy. Here, he assembled a multidisciplinary team and embarked on a methodical crusade unparalleled in its scale and ambition. The primary chemical arsenal consisted of organic arsenicals. Arsenic was a known poison, a substance of ill repute, yet its compounds had shown some promise. Thomas and Brainall had demonstrated that an arsenical called atixyl could cure trypanosomiasis, or sleeping sickness, in experimental animals. Ehrlich confirmed this but also discovered atixyl's tragic flaw: its use often led to blindness through optic nerve damage. He deduced that atixyl itself was inert and became active only after being chemically altered within the body. He tasked his chief chemist, Alfred Bertheim, with the monumental labour of synthetically modifying the atixyl molecule, creating a vast library of derivatives. Each new compound was a slight variation, an attempt to fine-tune the balance between toxicity and efficacy, to engineer a molecule with the perfect degree of parasitotropism. Hundreds upon hundreds of compounds were created, systematically numbered, and tested, first against trypanosomes and then other pathogens. This was a process of rational design, albeit one that required immense brute force iteration. It was a pharmacology born of the German chemical industry's ethos of systematic production. Compound number 1606, chemically known as the hydroxydiamino arsenobenzene dihydrochloride, was with such derivative. Synthesized by Bertheim in 1907, it was initially tested against a variety of protozoal infections and put aside, deemed to possess a modest effect and to be too difficult to handle. For 2 years, the potential cure for syphilis sat on a shelf, a testament to the subtle contingencies of scientific progress. The crucial turning point came with the arrival of Sahachiro Hata in 1909. Hata, a student of the great bacteriologist Sahachiro Hata, arrived at Ehrlich's institute already an expert in inducing and studying experimental syphilis in rabbits, a reliable animal model that had become available only recently. Ehrlich, recognizing Hata's meticulous skill, assigned him the task of rescreening the entire back catalogue of arsenicals for any effect against the newly identifiable Spirocheta pallida. It was a moment of profound synergy. Ehrlich's grand vision, Bertham's chemical synthesis, and now Hata's precise experimental execution. Hata's work was a model of scientific rigor. He systematically infected rabbits, waited for the characteristic syphilitic chancres to develop, and then administered single injections of the test compounds. When he reached compound number 606, the results were astonishingly clear and dramatic, as documented in their seminal 1909 paper. The effects were almost immediate. Within 24 hours of a single injection, the teeming masses of spirochetes vanished from the lesions. The chancres themselves began to heal with remarkable speed. The compound was powerful. Moreover, Hata's careful experiments established the drug's therapeutic window. He determined the dosis tolerata, the maximum dose the animal could withstand, and the dosis curativa, the minimum dose required to eliminate the infection. The ratio between these two figures yielded the chemotherapeutic index, a quantitative measure of a drug's relative safety and efficacy. For compound 606, this index was favorable. It possessed the high parasitotropism and low organotropism that Ehrlich had theorized for years. He had found his magic bullet. He called this principle of a single, decisive dose the Therapia sterilans magna, the great sterilizing. The public unveiling of their findings at the Congress for Internal Medicine in Wiesbaden in April 1910 was a sensation. Ehrlich, a master of scientific communication, presented the discovery with dramatic flair. The drug was given the evocative trade name Salvarsan, a portmanteau derived from the Latin for to save and arsenic, literally the arsenic that saves. The medical world and the public alike greeted the news with euphoria. Here, it seemed, was a definitive chemical cure for one of humanity's most feared diseases. The demand was immediate and overwhelming. The Georg Speyer Haus was inundated with requests from physicians around the world, and production was hastily scaled up in partnership with the chemical firm Hoechst. The impact was profound, changing the prognosis of syphilis from a slow, degenerative decline into a manageable, and often curable, condition. The discovery bolstered the public faith in science as a force for unambiguous good and cemented Germany's reputation as the world leader in biomedical research. The transition from the pristine conditions of the Frankfurt laboratory to the messy reality of clinical practice was, however, fraught with challenges. The administration of Salvarsan was a complex and hazardous procedure. The compound was an unstable yellow powder that had to be freshly dissolved and neutralized immediately before use, a task requiring considerable chemical skill. The required intravenous injection was itself a novel and difficult technique for many physicians of the era, who were more accustomed to subcutaneous or intramuscular delivery. Side effects were common, ranging from severe pain at the injection site and high fevers to the terrifying Jarisch-Herxheimer reaction, a systemic inflammatory response caused by the massive and rapid release of toxins from dying spirochetes. There were also reports of severe toxicity and death, some owing to improper preparation and others to the inherent dangers of arsenic. Ehrlich's initial dream of the Therapia sterilans magna proved elusive. Clinical experience soon showed that a single dose was insufficient for a permanent cure, and a prolonged course of multiple injections became the standard protocol. In response to these difficulties, Ehrlich's team continued its work, and in 1912 they introduced compound 9-14, or neosalvarsan. This new formulation was more soluble in water and easier to prepare, a significant practical improvement that broadened its clinical utility. The legacy of the 1909 paper extends far beyond the treatment of a single disease. Its most enduring contribution was the validation of a paradigm. Ehrlich and Hata demonstrated that new medicines could be created through a process of rational design, chemical synthesis, and systematic biological screening. This methodology became the blueprint for modern pharmaceutical research and development. The intellectual lineage is direct and clear. A generation later, Gerhard de Mag, working at the IG Farben conglomerate, a successor to Hoechst, would employ a similar systematic screening approach to test synthetic dyes for antibacterial properties. His discovery of the therapeutic effect of Pontosil, the first sulfonamide drug, was a direct intellectual inheritance from Ehrlich's program. De Mag's work, in turn, ushered in the age of sulfa drugs and created the environment that would so readily embrace the discovery of penicillin by Alexander Fleming, Howard Florey, and Ernst Chain. The very concept of high-throughput screening, where thousands of compounds are robotically tested against biological targets, or merely a technological acceleration of the methodical work performed by Georg Speyer, even as penicillin and subsequent antibiotics rendered Salvarsan obsolete for treating syphilis by the mid-1940s. The conceptual power of the magic bullet endures. It remains the guiding metaphor for much of modern medicine, from the targeted monoclonal antibodies used in cancer therapy to the development of specific enzyme inhibitors for metabolic diseases. The 1909 publication stands as a landmark, a watershed moment when pharmacology transitioned from a practice rooted in botany and happenstance to a science of pure chemistry and deliberate intention. It represents the ultimate fusion of Ehrlich's soaring theoretical vision, Berthaim's diligent chemical craft, and Hata's scrupulous experimental verification. It is a story of immense labour, intellectual fortitude, and the fortunate convergence of the right minds with the right problem at the right time. The paper itself is a testament to a revolutionary idea made manifest that humanity could, through the force of reason and systematic effort, design and build molecules of salvation, firing them with exquisite precision at the very agents of our affliction. The echo of that first magic bullet, fired in a Frankfurt laboratory, continues to reverberate through every modern clinic and research facility.
We really appreciate you tuning in to this AI-powered presentation. Our goal is to push the boundaries of AI in content creation, and your input is invaluable. If there's a particular subject you'd like to see us tackle next, or if you have suggestions on how we could fine-tune our AI's creative prompts, please don't hesitate to leave your ideas in the comments section. We're excited to bring you more unique content very soon.